When it comes to workplace violence and incivility, nurses working in hospitals and other healthcare facilities are usually disproportionately at high risk for that physical violence because of the very nature of our job. To maintain a good personal safety and environment free from any kind of potential physical violence, you first need to be alert to any signs of trouble. Not all healthcare workplace violence is of a physical nature initiated by patients or their families. We're also subject to horizontal violence and interdisciplinary incivility. Horizontal violence comes in the form of intimidating or derisive behavior between or among staff, managers, or physicians. It will interfere with your optimal job performance. It has negative effects on the delivery of giving good, high-quality patient care. I don't know if any organization can completely prevent or eliminate workplace violence, but with proper planning and having effective programs in place, the chances of that happening can be reduced. I love this picture because it's so typical what you may see if you have an issue such as this. And horizontal violence or your lateral aggression are usually terms that are used to describe anyone who's aggressive or has destructive behavior to their coworkers and what they're doing against each other. Other terms that we may also see is bullying or interpersonal conflict. These behaviors exist, and what really the sad thing, it makes toxic workplaces. Another term you may often hear used is incivility, and this includes a wide range of behaviors from ignoring to eye-rolling to yelling and eventually to personal attacks, physically and psychologically. Safety and quality of patient care depend on your teamwork, communication, and collaborative work environments. To make sure you have quality and to promote a culture of safety, healthcare organizations need to address the problems and behaviors that are going to threaten the performance of your healthcare team. Any kind of intimidating or disruptive behaviors can cause accidents with preventable adverse outcomes. The psychological stress of incivility can come in many forms, can lower work performance, encourage medical errors, and contribute to poor patient satisfaction. With all these issues related to incivility, there's also increased cost of care. They also cause qualified clinicians, administrators, and managers to seek new positions in more professional environments. Your workplace bullying is often reported to result in enough psychological distress to nurses to cause them to actually leave the profession. And these concerns underscore the urgent need already that's out there to prevent patient-to-nurse and nurse-to-nurse violence. When you have a toxic workplace, there's dysfunctional attitudes and emotions seem to permeate the entire atmosphere. This phenomenon harms both the company and other employees. Over time, positively motivated employees start to drift away from the workplace, and only those employees comfortable in the negativity charged atmosphere actually remain on the staff. So these individuals stay while others go. Organizations who articulate a strong set of cultural values regarding communication, respect, and professionalism, as well as an evaluation system that's going to rank both technical performance and the professional treatment to fellow employees, are usually those that are going to less likely have a development in a toxic environment. Back in 2008, the Center for American Nurses published actually a position paper stating that there's no place in a professional practice environment for lateral violence and bullying among nurses or between healthcare professionals. These are disruptive behaviors that are toxic to the nursing profession, and they have a negative impact on the retention of quality staff. Your horizontal violence and bullying should never be considered normal, and it should not be related to any kind of socialization in nursing, nor to be accepted in any professional relationship. That statement goes on to assert that all healthcare organizations should implement a zero tolerance policy related to any disruptive behavior, including a professional code of conduct and educational and behavioral interventions that are going to assist these nurses in addressing disruptive behavior. We also saw in 2008 that the Joint Commission revised its standards for disruptive behavior, calling for the identification of manifestations of abuse and violence in healthcare organizations. One of the recommended policy is the zero tolerance for intimidating and or disruptive behaviors, especially in the most egregious circumstances or instances in disruptive behavior, such as assault or criminal acts. Your organizations are encouraged to have interprofessional dialogue across a variety of forums as a proactive way of addressing ongoing conflicts, overcoming them, and moving forward through more improved collaboration and communication. There's two approaches to dealing with incivility and the toxic workplaces that it actually creates. One is from an organizational level that includes primarily establishing specific behavioral values that are going to address professional, courteous, and respectful interactions among all staff. You're going to have managers, supervisors, and administrators should model your professional ethical behaviors and try to foster an environment of mutual respect. Bullying or disruptive behavior may be addressed and closely tied to performance evaluations with clear descriptions of the consequences to not adhering. This implementation must be a ground-up strategy that brings the front line and administration together. You're going to have team strategies that can be used to identify and take on civility wherever it is. Training and recognizing bullying behavior and conflict management can help individuals create a zero-tolerance environment for any type of bullying behavior. Lastly, individual assessment is related to how an individual deals with incivility or bullying. Do you ignore it when it happens, or do you participate in the incivility without even recognizing the results of your actions? Do you gossip about the other staff members? Do you have feelings of superiority over others? Do you communicate with respect? Sometimes it takes stepping back and taking a good look at yourself. Being part of an organizational team that works to establish a cultural norm of civility can be an eye-opening experience. Such teamwork to keep civil behavior reinforced as part of an everyday functioning. Being a member of this team can also teach skills on how to manage acts of incivility and provide the base to build stronger work teams. And that's all I have for this week.